right, you guys, this Wednesday is March, which means it's Colon Cancer Awareness Month coming up soon. And we're excited to talk to Gaby Vargas. And we're talking about pelvic floor dysfunction, which is caused from issues in the colon, right?
Correct.
Okay, well, so explain what it is.
So pelvic floor dysfunction encompasses a wide range of disorders, and basically what they lead to is either problems restraining bowel movements or emptying bowel movements.
Dr. Vargas, do women deal with this more than men, and why is that?
Yes, so this disorder can affect both men and women, but it affects women disproportionately more. And the reason for that is mostly because women bear children. And so that puts a lot of stress on the pelvic floor, and that can cause a lot of the issues that can ultimately develop over time.
Okay, that makes sense. Okay, so how is it evaluated?
So we usually begin with a very thorough history and physical examination. The physical exam will include an examination of the pelvic floor. One of the things that we're very interested in women in particular is their obstetrical history. Have they had prolonged labor, forceps-assisted deliveries? Have there been any tears or episiotomies? And then we also focus on the bowel pattern. Are there any issues with diarrhea or constipation just at baseline? And then we want to know whether or not there has been prior surgery in that area, in the pelvis at all.
So there's a wide range of conditions,
yes,
right, that
yes,
the pelvic floor encompasses.
Yeah, correct.
So if you're sitting at home right now, how do you know that yours needs to be treated or you need to be seen?
So again, like I said, some of the conditions can be fecal incontinence, so not being able to hold in a bowel movement, having a lot of urgency and not having enough time to get to the restroom, or it can be issues with constipation, feeling as if you're not evacuating completely, having a lot of pressure in the pelvis, and sometimes it can just be pain, just having chronic pain either while going to the bathroom or during sexual function.
Okay, so how is this treated once it's diagnosed?
So thankfully, most of the disorders can be treated without surgery. The primary component of treatment for a lot of these things is usually biofeedback, which involves treatment with a physical therapist who specializes in pelvic floor disorders. We sometimes use medications, and then in some instances surgery as well.
Do you find that a lot of us just don't want to talk about this?
Absolutely.
That we put off seeing you because we're thinking, oh, like what's going to happen next, and can it actually be fixed?
Yes, the symptoms are uncomfortable, they're inconvenient, and they're embarrassing, and so nobody wants to talk about it. Even coming to see me, people are a little bit embarrassed and just shy about describing what exactly has been going on. And some patients I've seen have lived with their symptoms for years before they seek treatment.
Okay, so having lost my dad to colon cancer, I'm curious to know is this something that could cause colon cancer if it's not treated?
No, pelvic floor disorders and colon cancer are two completely separate disorders.
Which is good to know. And I really want to push colon cancer screenings while we can. Anytime we talk about colon, anything, I'm like, get your screenings done.
Yes, absolutely. So for anybody that is 50 years old or older, you should be screened for colorectal cancer because everybody's risk of developing colon or rectal cancer increases at age 50 or above. If you don't have any risk factors such as a family history of polyps or a family history of colon and rectal cancer, you're generally screened every 10 years. If there are risk factors, then that screening can be performed in a shorter interval.
How's our screening rate here in Utah?
I actually don't know what exactly the screening rate is, but nationally, the last time I looked at it, it was only about 40%.
All right, Dr. Vargas, look in that camera and say it ain't no thing.
It ain't no thing.
It ain't not. It's so easy. In fact, Michelle getting it done in the next several weeks.
Yeah, we're going to document the whole thing so you guys can see it. Literally documenting.
Literally. Which
maybe not literally.
Okay.
The toughest part is actually the prep. So what you do the day before the colonoscopy just to make sure everything is cleaned out. But the procedure itself, you get anesthesia, you're nice and sleepy, and really it's very little discomfort.
It's a nice little flush.
It is.
Just a quick little get it all out of there.
Right.
LDS Hospital. If you have any questions about anything that we've been talking about, please go to their website for more information, ldshospital.org/healthyliving, and we can link you to all of that information on our website too. Dr. Gaby Vargas, thank you so much.
You're very welcome.
for joining us today.